Blood clots form when blood cells and blood components stick together, blocking blood vessels. Deep vein thrombosis, or DVT, is a blood clot that forms in a deep vein. Most clots occur in the leg or arm. Cancer and some associated treatments are risk factors for developing blood clots. This condition is known as cancer-associated thrombosis, or CAT. Some additional risk factors are being pregnant or having had a baby less than 6 weeks ago, being immobile such as prolonged bed rest, long distance travel, or limb immobilization in cast or boot, family history of blood clots, having had surgery less than 90 days ago, thrombophilia, some kinds of contraception containing estrogen, heart, lung, or inflammatory diseases, being over 60 years of age or overweight, or having varicose veins that become red and sore. While all people with cancer are at risk of developing blood clots, some are more at risk than others. This depends on the type and stage of cancer, treatments. Although these are vital to fight cancer, some therapies increase the risk of clots forming. Being admitted into hospital or being immobile, such as being confined to a bed for a long time, heightens this risk. It is important to recognize the symptoms and to speak to a doctor immediately if you experience any of these. Swelling in a foot, leg, or arm, pain, cramping, and tenderness in your foot, leg, arm, or neck, warm or heavy sensations or pressure in a limb. If untreated, part of the clot in a deep vein can break off and travel to the lungs, blocking blood flow. This can be potentially fatal if not detected early. Symptoms of a pulmonary embolism include unexplained shortness of breath, chest pain, especially when breathing deeply, an irregular or fast heartbeat, lightheadedness or dizziness, and coughing up blood. If you notice any of these symptoms, contact emergency services right away. Some people mistake blood clot symptoms for normal side effects of cancer treatment. However, if you are in any doubt at all, seek medical advice immediately. Minor lifestyle changes can make a difference. Ask your doctor for a blood clot risk assessment. If prescribed anticoagulant medication, take it exactly as directed. Keep moving as much as possible. Drink plenty of water. Quit smoking. If directed to wear compression stockings, ensure that they fit correctly. Treatment of blood clots is effective and relatively simple. Anticoagulants are often prescribed. These can treat blood clots and help prevent new ones from forming. Treatment duration can vary depending on your cancer. You should continue to take your anticoagulation medication unless your doctor or nurse specifies otherwise.